but not necessarily infection. So those that could be asymptomatic may not necessarily be captured, and as we have seen, asymptomatic individuals can still spread the disease. Now, in terms of the effectiveness of after one dose, again, you need that 2 doses to be effective, the most effective. And also in terms of longevity, you need to, again, take those 2 doses. But interim studies does show that even after 1 dose, it is about 82% effective.
Okay, thank you. We have another question on the chat. This is from Maria Roberts. When do we think the vaccinations will begin being administered to this initial targeted population? In other words, when will we begin actually doing the vaccinations?
So that depends on when the state can get those vaccines and delivered. So we are hopeful that it will be sometime mid next week, but we don't have an exact date. And obviously all hinges on the EUA approval, and hopefully that will come no later than today.
Thank you. We have another question from Lori. Do you want me to read it, or do you want to raise your hand and ask it? You're muted.
I can ask.
Okay.
Just go a little bit into how do you expect to coordinate the vaccination efforts? Will they be going to the nursing homes to give the vaccines, or will you have sites set up for people to come and get them?
Okay. First, in terms of storage of where the vaccine is going to be, it's going to be in a secure location. We're going to follow the guidance according to the manufacturers. Obviously, it does require that ultra cold chain aspect of that. Now, in terms of the administration of the vaccines, that's going to be done in conjunction with these paramedic strike teams, with the National Guard sort of coordinating that, and we will be going to the facilities.
I don't have any other questions from the chat. Does someone else want to ask?
Can I hop in?
Sure.
I'm with Channel 10. Thank you.
Hi, Angelina. Yes.
Hi, how are you?
Good, how are you?
Good. Dr. Cho, I just wanted to ask you if Pinellas County has any vaccines currently in stock right now, or is that something that we're still waiting to get?
We currently do not have any of the vaccines. I don't believe it will be released until that EUA is approved.
Okay, and then in terms of manpower-wise and you guys having to put this together, when did Pinellas find out that they were going to be a part of this, and what has it taken for you guys to actually put this together? How many people are going to be a part of this team?
Obviously, it's been a large partnership. Again, paramedics, we're going to use what we've done in the past using the regional incident management team structure. As you recall, in terms when we did these various outreaches and initiatives through the nursing homes, we did the testing, we did infection control. So we'll be using that same kind of model. In terms of when we found out, it was earlier this week, and since that time, I can tell you there has been a lot of pre-planning that's gone into this. We will be, and we have reached out to some of the nursing homes, and we plan to hold and host 2 or 3 calls before the launch of this initiative with all the facilities.
Thank you. I have another question from the chat from Kelly Fairclough. She says, I apologize if I missed this. Do we have a priority list? For example, nursing homes, healthcare workers, other public servants such as police officers, etc.
For this specific pilot mission, the focus again will be mainly the nursing home residents as well as staff. So in terms of priority lists, would defer that to what the ACIP and what the Florida is putting out there as the 1A priorities. That does include the healthcare professionals as well as long-term care staff and residents. Hopefully that answers your question.
And we have another one. When or where will we have camera access to see the vaccines arriving at a secure location? And when can we see it being injected in those who are willing to be shown on TV? That may be hard to answer right now since we don't have the vaccine and we don't know where it's going, but I don't know if you want to take that on.
We'll definitely try to keep everyone posted on that. Obviously, if footage, and I know that you guys are probably all interested in some sort of footage, that will really be dependent on those specific facilities. So that I think that would require permission from them, but I do not want to speak for them.
We have another one from the chat. Dr. Cho, what are your thoughts regarding those who have a family history of Guillain-Barre syndrome after the flu shot?
I'll defer back to what the EUA is going to say, because within the EUA fact sheets, within what's approved within the EUA, it does have specific inclusion and exclusion criteria. What I can say of the phase 3 studies, that there wasn't any concerns of that Guillain-Barre similar to the flu. It does work by a different mechanism. I am aware of these anaphylactoid reactions that's been happening in the UK, and I am curious as to what the FDA sort of puts out there in terms of EUA, whether it will be indicated for those with severe anaphylaxis type of reactions.
Okay, and then we have a question in the chat, but it's also from Angelina. So would you like to ask it, or would you like me to read it?
Sure. Dr. Cho, just looking to see, what are we really looking to see and find out during this pilot? And if it's successful, will Pinellas County continue being a strike team for the state?
Obviously, what we want to do is try to deliver safely and effectively the vaccine to those willing to take it among the nursing home staff and residents. In terms of the Pinellas strike team, it's going to be, I think we're charged with trying to develop that pilot, and if it's scalable, the other areas of the state can use as well. So I think that's what we're trying to accomplish with this pilot.
I also have another question from Lori Davison. Will healthcare workers also be given this pilot project vaccine? Or is it just nursing home residents?
It's nursing home residents and staff, so the healthcare workers within those nursing homes.
Yeah, I don't see any other questions, either in the chat or by raising your hand. Okay, last call. Angelina, you have one?
Yeah, I'm sorry. I was trying to unmute myself. In terms of, I know that this is just the first step in us having this ray of hope for the COVID-19 pandemic, but what would you say to people at home that are wanting to get vaccinated and do not fit the criteria that's needed to get vaccinated right now?
Okay, I would say be patient. We are limited by both the supplies. We follow the federal guidance and as well as the ACIP guidelines. That's the Advisory Committee on Immunization Practices. We do need to prioritize those at higher risk, again, with the healthcare workers, the long-term care residents. But as we get more vaccines available, it'll be more widely available to the general population. We certainly will communicate that. Work with your medical providers to answer any questions you may have and concerns about the vaccine. And if needed, we will continue to work with community partners to do these community vaccination drives if indicated and needed.
I do have one last one. How are we keeping track of who's gotten the vaccine and when their 21 days are up for them to get the next one? Okay,
that's a good question. That you do bring up a good question. I think a few months down the road, there is going to be a number of different vaccines out there. Most of them do require the 2-dose, and it's important to remember that you need to get the second dose needs to be exactly the same as the first dose. It is not interchangeable. In terms of tracking, we do have a immunization tracking system in the state of Florida called Florida Shots, and that will be all monitored through that system.
Does it fall on the patient? Sorry, I'm just asking. Does it fall on the patient to also do their due diligence of knowing, okay, I may be coming up around this time frame, I should go in to get the other shot? Or will you guys be reaching out to them to let them know, hey, it's time for you to come in, let's schedule this so that you can get your second dose?
It's probably going to be a combination. Obviously, for anyone with a medical chart, it should be recorded there as well. It'll be recorded in the Florida Shots. We'll put reminders in both their systems, give cards, and we're working, trying to implement an automated reminder as well.
Immunity-wise, would you say that you fully build your immunity once you get that second dose, or are you covered just getting that first dose?
Well, like any vaccine that requires multiple doses, it's important to get both doses for two reasons. Number one, you do have higher effectiveness when you get those dose number 2. Additionally, in terms of longevity, you have a better chance of having sustained immunity if you get both doses.
Is there someone with a 562 number that has a question? If you are, you're muted. 562-4533, if you have a question, you're muted. Oh, here's another, here's a question from the chat. Have we talked about whether or not we expect this virus to mutate like the flu?
So, less likely. The flu virus and the coronavirus are little apples and oranges, and I'm not going to get into the science, but the flu virus has that propensity to mutate a lot faster. That's why we do need that annual vaccine for the flu. The coronavirus is, and the vaccine that works against it is more stable since it's targeting one set of protein, and that spike protein of the coronavirus. But in terms of transparency, just because the studies have not gone past 3 months, we don't know the exact longevity and how long this vaccine is going to last, and you'll have that immunity. In terms of the long term, I'm hopeful that we could that the immunity will be there for 1 to 2 years, but that is to be determined at this time.
If there's any other questions, or please put them in the chat or raise your hand. If not, I'm going to give Dr. Cho last opportunity to say any parting thoughts. And if you need PIO assistance after this, please reach out to me or to Tom Iovino. We'd be happy to help. So, Dr. Cho, any last thoughts? Anything you want to add?
No, I really appreciate everyone being here. Again, I think this is a great opportunity for Pinellas County. I'm thankful for leadership that we were selected as that pilot site. And again, anything that we can do to protect the vulnerable population, and I believe these are the first steps in that right direction. So thank you again.
Oh, here's one question. I'm sorry. What happens if it's greater than 28 days for the second dose? In other words, you get your dose 28 days later than 28 days after.
Again, I think something as specific as something like that, I think that we need to wait for the EUA on those kind of details. I think there is a little bit of wiggle room, so it doesn't have to be, it's 21 days for the second dose. I think there's a little bit of wiggle room a few days before and a few days after, but again, the EUA is going to stay all of that.
And Kelly Faircloth says, thank you, really great information. We appreciate your time.
Okay, thank you guys.
And we do appreciate your time, and thank you for everyone, to everyone who logged in on such short notice. We really appreciate you guys wanting to get the message out to the community and to get it straight from the source. So again, if you have other questions later, reach out to either Tom Iovino or me. But if there's no further comments, we'll close the session now. So thank you for being on, and we'll see you all later.
Thank you.